Jamaica's most vulnerable were brought into the spotlight amidst the rising asymptomatic cases of COVID-19 in the country. With elderly persons more susceptible to the effects of the virus, the Ministry of Health is moving ahead with plans to have specific guidelines instituted for the island's nursing homes. A study led by the Standards and Regulations Division in the Health Ministry showed that some nursing homes are ill prepared to deal with an outbreak. The finding is based on an inspection of 100 nursing homes.
Regarding the layout of the facilities, the space, the size of the rooms, the size of the space between beds and so on. What we find is that there could be a risk as it relates to a COVID outbreak of an infection developing and spreading in those homes based on what would be considered crowding. And then that would result in us having a difficulty in implementing social distancing. This has to do with the sharing of common space because we have more than one person in a room based on the standard that was established. They share restrooms, they share recreational area. And so given the nature and the size of the homes and the number of the persons who are there, the number of residents, then have a challenge with crowding. However, our team is working closely with the homes to manage such.
Director of the Standards and Regulations Division, Cynthia Lewis Graham, says along with crowding, the handling of laundry poses a potential risk.
Then there's the possibility of improper handling of laundry. How is it that they handle what would have been considered medical laundry versus general laundry that has to be separated and handled differently? How is it that they handle medical waste and food preparation? Those are issues that could be a risk as it relates to the overall infection prevention and control strategies and the measures that are in there. That could be negatively impacted by resources because some of our inspections have shown that some of the homes are within areas that have challenges with water, with piped water. So we could have a challenge as it relates to water shortages in some of those facilities, which would negatively impact the infection control measures. Strategies that we have put in place so far and will continue to work with to monitor is that we have developed and we have issued COVID-19 specific guidelines and protocols to these homes.
She says training will now be provided to operators of nursing homes on how to deal with residents who test positive for COVID-19.
We intend to do virtual training with the nursing home proprietors, and that is going to be done by the registration unit here in the Ministry of Health. We have been working with the nursing homes through the public health inspections that have been carried out to identify isolation areas in the facility. Should there be a need, if there's a suspect case, that the person should be isolated from the residents and what action they need to take if such a situation develops.
Nursing homes are now inspected at least once per week. O'Shane Masters, Frontline News.